hoping that this has gone live publicly and I'm not just talking to myself. If I am just talking to myself, the video will be shared on our YouTube channel and on our page, so it can be watched back anytime. I'm just going to wait a minute to see if anyone is joining live. In the meantime, I will just start chatting a little bit. So I'm Rosie Bescoby. I am a full APBC member. I own and run PetSense, which is based in Bristol and North Somerset. And I'm going to have a chat with you tonight about senior dogs and their behaviour and the changes that we might see as our dogs get older. So if you are joining live tonight, feel free to ask any questions at all in the comments. If you are joining late, again, I will be here for probably 30 to 45 minutes, so feel free to pop your comments in. If I don't get round to answering them, I will respond. I will type a response if it's, and I'm really sorry, I've got a very annoying tickly cough. I will type a response if it's short enough to do so, or I will try and link a resource for you to answer your question. And if you are watching this and I'm not live anymore, again, feel free to pop a question in. I'll keep an eye on it over the next couple of days and I will answer your question either with a comment or I will post a link for you. So as I said, my name's Rosie and I have got a fair amount of experience with older dogs and the changes that occur when our dogs get older. I've had a couple of rescue dogs that we've taken on as geriatric dogs, and I've had a couple of dogs that I've raised from puppyhood up through to their senior years. At the moment, I've got a 16-and-a-half-year-old Jack Russell Terrier cross called Spice, who is the first of all of my older dogs to be exhibiting quite severe signs of cognitive dysfunction. So the other three had more physical changes that led to their us having to say goodbye. Spice at the moment is going through quite a lot of cognitive changes. And so, yeah, I'm going to chat to you tonight about those two different angles really of the changes that happen in an older dog, because there are inevitable changes that happen to both the body and the brain as dogs age. And the age at which we kind of class dogs as senior or geriatric is going to vary a little bit between whether you've got a large breed dog or a small breed dog. So for example, an 8-year-old Great Dane is going to be very, very old for their age, whereas an 8-year-old Jack Russell is maybe not quite so much. They can live up to, as I said, Spice is 16-and-a-half. I'm hoping she's going to break the world record for being the oldest dog in the Guinness World Record book. Don't we all with our dogs? But you might also find that the bigger dogs, it's more their bodies that fail them before their brains, and the smaller breed dogs, maybe their brains start to go when their bodies are just going on and on. So if we start by thinking about the physical changes that occur as dogs can get older and the associated behavioural changes with those physical changes, we've also got the changes to the brain are probably the most obvious to us in terms of their behaviour change. And the other thing to consider as dogs get older is that they will often go through sensory deprivation. So they will start to lose their sight and the hearing loss potentially, and those can lead to some noticeable behaviour changes too. So when we look at the physical signs of ageing, we'll often look at our older dog and put natural slowing, a dog that's naturally slowing down, we will often just attribute that to the dog that's getting older. But it's really important to recognise that the dog that's slowing down is slowing down due to physical changes, so discomfort, pain, potentially even heart issues. And so it's very important as our dogs get older and we start to notice any changes in them that we do speak to our vet. And a caveat I'm going to throw in throughout this whole live is that it's really important to speak to your vet and make regular contact with your vet. As a caregiver, no one knows your dog like you do, but as our dogs age, we are effectively being desensitized to their aging. And when we live with them every day and we see them every day, and we're also emotionally invested in them, so an outsider's input and a professional, a veterinary trained professional, their input on a regular basis to assess their comfort and their welfare, to suggest changes to diet, supplements, pain relief, other medications to support your older dog, or to treat any other ailments that they may have concurrently, is essential. So I will just keep throwing that in here, that because there's a huge link in all behaviour problems, there's a big link between physically stuff going on with the dog, but also behaviourally, even more so perhaps with the older dog and the changes they're going through. So when it comes to chronic pain that we might see creeping in, we may notice behavioural changes not just associated with slowing down, but also in terms of their tolerance to things that they previously tolerated. So whether that might be fireworks, or whether that might be children pestering them, they're basically, if they are suffering from any sort of chronic discomfort or pain, they're going to be less tolerant. I don't know if any of you have ever suffered from chronic back pain, for example, or migraines, but we're generally a little bit more irritable, less tolerant of things that we would normally choose to ignore and tolerate. So it's really important to recognise that as dogs, if they are feeling uncomfortable, and this is true again for any dog, even if they've got something like an ear infection or a tummy upset, or they're very itchy, but very typically in the older dog, things like arthritis creeping in can lead to an element of chronic pain, and that can lead to a reduced tolerance in other things that they behaviourally would tolerate. So the first thing to do is acknowledge that and recognise that, and make sure that we remain an advocate for our dog, particularly our older dog. The second thing to acknowledge is that dogs that are experiencing any sort of pain or discomfort will be constantly forming associations between external events that are going on and a pain response. So if they, for example, if the dog startles in response to a loud firework going off overhead, and that might trigger hip pain where they've got a little bit of arthritis flare up at the moment, then that's going to lead to what we call a negative conditioned emotional response to fireworks. So they start to associate fireworks can cause pain, and that then leads to a fear of a negative anticipation of fireworks and the effect it might have. So not only can it cause reduced tolerance, it can also lead to a negative association with external events. So it's really important to be able to understand why an older dog might start to lose their ability to cope in certain situations. And again, that goes back to the first step before we even look at any sort of behaviour advice, is to make sure that we've got the pain and the discomfort under control. So the vet is always your first port of call. When we look at dogs who are experiencing brain changes, so there are a couple of different kind of terms for this. I'm going to call it throughout this canine cognitive dysfunction. There are some similarities between canine cognitive dysfunction and human dementia, but there are various different types of human dementia. We know that there are brain changes that are going on in a dog with cognitive dysfunction that are similar to some of the dementias that humans get. And some of the symptoms of canine cognitive dysfunction that we might observe are things such as general disorientation. So, for example, my dog will sometimes get stuck in places. So she will go to the hinge side of a door waiting for it to open, or even when it's open, she will still go to the hinge side of the door rather than the door that she's been in and out of for the last 10 years of her life through the normal side. She will get stuck in places that she never used to wander to before, but she can't figure out how to get herself out of them, so how to walk backwards, or how to get out of behind the TV, for example. They might show changes to their sleep-wake cycle, and by that I mean they might be awake a lot of the night, and this is one that's particularly difficult for caregivers. Luckily, touch wood, we're not experiencing that at the moment. She is sleeping an awful lot during the day, and again, that's a normal sign of aging, but it can also be a symptom of other things going on, including pain, where they're less inclined to want to move or get out of their bed because they're a bit painful. They will show toileting changes, and that can come in a couple of forms. One is toileting in the house, which we are getting an awful lot of here. The other is if they are going outside, you might just notice that they've completely changed where they have historically always gone to the toilet. So for example, if they've always chosen to go on the grass, they might suddenly just start using the patio. So we're seeing that when she does go outside, but also we're seeing an awful lot of toileting in the house. And that's partly, I think, physical due to getting to the right location in time, but it's also due to that complete disorientation, I think. We might notice changes in interactions. So our dogs change in interaction either with ourselves, with unfamiliar people, with other animals in the home, with other dogs, unfamiliar dogs on walks. And sometimes that might be that they become more social, sometimes it might be that they become less social. Again, with the latter, if they're becoming less social, we need to make sure we're excluding any pain or other elements that might be contributing to that. Or it might just be, and I can't really put my finger on this and explain it very well, but it might just be a change in interaction, not really for the better or the worse. And that's certainly what we're seeing with our little dog at the moment. She's no less sociable with us, but she's just changed in the way she interacts with us. It's just like she's a little bit of a different sort of dog. Some dogs can get quite confused and distressed by some of these symptoms, and that again is a welfare concern and upsetting for owners to be, witnessing that as well. So some dogs will start to experience some separation distress because being on their own, and this is sometimes I think where the nighttime waking comes in as well. Being on their own is quite a vulnerable place to be when you are confused, you don't really know what's going on, you don't know where anyone is, you don't know when anyone's coming home. Again, if you've got any concurrent pain going on, that's also going to contribute to separation issues, where a bit like children really, when you're feeling out of sorts, they just want their secure attachment figure, and that's no different to dogs, and our older dogs in particular. Again, luckily so far we're not experiencing anxiety or distress. She's just completely oblivious to what's going on really, and she's got good quality of life still, and I'm going to come on to how we monitor quality of life in a moment. So what is actually physically going on in the brain in these dogs that are experiencing cognitive dysfunction? So we've got a few things going on. One is that the brain isn't getting enough blood flow effectively and isn't getting the fuel that it needs from the glucose going around the blood. Another is that the brain starts to form what we call amyloid plaques, and these are basically calcium and protein deposits that clump together in neurons, so it's affecting the neuronal pathways within the brain. Another is that cells are less effective because I'll come on to that in a minute. Cells are less effective at clearing away toxins in the brain, and it also causes a kind of chronic inflammation in the brain. And the fourth sort of changes that are going on in the brain are that free radicals are in the brain damaging brain cells, and this is what we call oxidative stress. And because of the free radicals damaging the cells, that's when the cells stop clearing away the toxins, and that's what causes the chronic inflammation. So free radicals are basically a byproduct of the body's metabolic processes, and in a young healthy animal, our brain is set up to remove, there are no free, our brain is clearing up the free radicals all of the time. And they're basically unstable atoms that damage cells and cause aging and disease. So antioxidants will fight free radicals and maintain cell function in a healthy young animal. So some of the things that we can think about as a preventative, and in dogs maybe kind of heading towards the age 6, 7, 8, or in those dogs that we think are just starting to show the first signs of cognitive dysfunction, there are things we can do in terms of their diet, and that might be a change in the diet or it might be supplementing the diet. And again, this is a conversation to have with your vet. But I am just going to explain some of the vitamins, I suppose, that we can, and what they do to an aging brain, or how to prevent a brain from, or how it doesn't prevent, I shouldn't have said that. Don't want to give anyone hope. It will slow down the aging process in a dog that hasn't yet started showing problems, or in a dog that's only just starting to show problems. So the antioxidants that we were talking about, a diet with antioxidants in, which is basically your vitamins C and E. We also need to make sure that they've got a diet high in a lot of the B vitamins. Omega-3 fatty acids are also going to contribute to neuronal health and blood flow. We've got various other natural supplements that are in supplements and in diets that are aimed at the older dog, such as ginkgo biloba, sorry, pronounced that wrong, and boswellia, and coenzyme Q10 as well. So all of those are sort of things to look for, and as I said, your vet will be able to talk to you more about what specific diets are out there aimed at the older dog, or what supplements you can add in to help prevent. And I think a lot of people consider, when their dogs get a bit older, getting them on a joint supplement as a preventative, and I think it's a really good tip to get older dogs also on a brain kind of supplement, brain and aging supplement as a preventative. You won't, if your dog's not currently exhibiting any signs of cognitive dysfunction, you won't notice any difference in them by starting them on an anti-aging supplement, but because the supplement isn't getting rid of plaques in the brain, because there aren't any plaques in the brain at this stage, but hopefully it's delaying the onset of cognitive dysfunction a little bit. And again, there have been studies that show in dogs that are showing the first signs of cognitive dysfunction that we can prevent further build-up of plaques, further free radicals in the brain, for example, and slowing down the deterioration. In dogs that are showing anxiety and distress, we need to speak to our vet about potentially adding in some psychoactive medication to help with those symptoms specifically, because, as I said before, that is becoming a welfare issue when you've got a dog that's not coping with their symptoms. And something I also want to raise is the impact that this has on the caregiver, because whilst the welfare of the dog is obviously one aspect of this, and hopefully everyone's priority, the other aspect of this is the impact on the caregiver. And it's really difficult living with a dog with advanced canine cognitive dysfunction. It's difficult both in terms of the practicalities of living with it, but it's also difficult in terms of the emotional side of watching our dogs deteriorate, and in terms of knowing when the time is right. And I think it's something that's on caregivers' minds most days, and something that by the time we're kind of in palliative care stage, it's something that does need to be monitored on a daily basis. And there are various quality of life questionnaires that are out there. I don't have a preference, but what I do tend to do is do multiple ones of them on a regular basis, so I know I'm covering all bases in terms of the questions that they ask. And to start with, when my little dogs was sort of showing moderate signs of canine cognitive dysfunction, I would do those welfare questionnaires, maybe on a monthly or fortnightly basis. But as the things have progressed, I've started to do them far more frequently. And another tip that some people can do is they keep it a little bit more simple, and they have a traffic light system where they grade it from green being the dog's having a good day, red being the dog's having a bad day, and amber that it's somewhere in the middle. And each day you just make a note or draw a colour chart of what they are that day. And when we start to see the red days and the bad days creeping in more frequently than the good or the amber days, then we might need to start thinking about speaking to our vet really about when the time might be right. And no vet is going to judge you on when it's time to say goodbye. And we all know the phrase that we'd rather it be a day too soon than a day too late. We all know, really, those of us living with it, we all know it's only going one way anyway. It's only going to end up somewhere. And it's just making sure we grade each day so that we know these dogs are still having positive welfare despite the changes going on in their brains. So I said about my little dog still, her welfare is not compromised to the extent of us making the decision at this point. She still enjoys a little morning walk. She still enjoys her food. She's very, very excited for her food. She still does interact with us regularly, even though the type of interactions have changed. She enjoys having the zoomies or having a mad one every couple of days. She hasn't got very good breaks anymore because, as I said, there are physical changes going on with them often as well. So she does sometimes crash into things while she's having the zoomies, but luckily nothing's caused her too much, any damage, and she seems to shake it off and carry on after she crashes. So yes, as I said, it's something we are constantly monitoring. I will pop some of the links in the comments to the quality of life questionnaires and some other resources and articles that I've found really, really helpful as I've been navigating this journey with her. That hopefully some of you might might find useful as well. I'm not sure if I can see Nicole. Yeah, the traffic light system is a fantastic idea, as it can also help carers to feel they're being proactive and useful. That's exactly it. And I think sometimes we feel a little bit lost in terms of what we can do. But yeah, absolutely. I think that's a really good way of grading it. So we've talked about nutrition, we've talked about the supplements and diet, we've talked about psychoactive medication if there's anxiety and distress. Some of the other things that we can do for our older dogs with cognitive dysfunction is ensuring that we maintain or increase even their mental stimulation. And this is again particularly true when a dog is physically compromised. But we need to make sure their lives are still enriched, and we can do that in dogs who aren't able to process or learn or remember things that we're trying to teach them, like the younger dogs. And this is also true for the dogs that are physically compromised and they can't go on long walks or chase their ball anymore. And we do need to make sure we substitute that enrichment for some more static type of enrichment at home. And one of my favourites for these sorts of dogs, and to be honest, any dog, is simple scent work. And by that I mean that you're just getting them to use their noses to search for things. So the seeking system in a dog's brain will activate dopamine, which makes them feel good. It doesn't need to involve a huge amount of physicality. In fact, it can be a really static game where you just get a snuffle mat and hide some treats in it, and the dog has to snuffle around the mat to find the treats. If they are a little bit more physically able, you might do some hiding bits of their evening meal or some treats around the house, and they have to go around and search for them with their nose, keeping it to a smaller area, a small room if they are physically compromised, or hiding a favourite toy, for example, and getting them to search for it. We need to make sure in dogs that are physically compromised that we're doing everything at a level that they're able to do, so we're not causing them to have to reach or jump up or get under things that they're not physically able to. So yeah, we need to make sure, even for some older dogs, physically it's difficult for them to lower their head, so this is where raised feeding bowls can come in. But also, if we're going to hide things for them to search for, make sure that it's things that are at head height for them. We can also we need to make sure with both dogs with physical difficulties and with the brain changes that we are avoiding any form of slippery flooring in our home as well. And this is difficult where you're also combating toilet training. But for those dogs that are physically compromised, they can feel really quite vulnerable if they are on slippery floor, or floor that just isn't grippy, I should say. Not necessarily slippery floor, but floor that isn't grippy. So i.e. not carpets or rugs, hard floor basically, because they know that their legs, they can lose control of their legs can slip at any time. And So make sure we do have cheap rugs and runners around the home. And that's also true with the cognitive dysfunction, because I think rugs and runners can also help them navigate their way around the home a little bit more. They're using their sensory system to figure out where they are and where they're going. So it might lead them into a certain direction, i.e. towards the door, if you need to encourage them to go out to use the toilet. In furry dogs, make sure that we keep the fur between the pads of their paws trimmed as well, because that can really induce slipping where they've got hairy feet, and that can lead to feeling like a bit like wearing socks on hard flooring. You're more inclined to slip. So make sure we keep that trimmed down as well. We need to make sure that we are, if we've got a dog that's exhibiting separation distress, that we are trying to it takes a village, really, the same as any dogs with separation issues. But in your older dog, we might need to make some changes to our routine. We might need to recruit family members, friends or neighbours to help with that. We might need to change where we sleep at night, or where the dog is sleeping at night, just so that we are providing them with that security and that security blanket until it's time to say goodbye, really. Medication may help, but it's not going to resolve the issue completely. So we may need to look at changing our routine in terms of how long we're out of the house for example, and our working regime if we can. With toileting, there isn't a huge amount we can do. If you've got a dog that will be encouraged to use puppy pads, that can be useful just for clearing up. The one thing that is really important to say is there is no point in telling a dog off for toileting in the house. That's true whether it's a puppy learning where to go. Also, for an older dog who's lost control, their brain changes mean they have no control over this. So telling them off, even though it's frustrating from a human perspective, telling them off is simply going to increase their anxiety levels and their confusion. They don't understand where they should be going. They can't physically cross their legs to get to the point of holding it till they're outside. There is nothing we can do about that. There is no point in telling them off. We might need to, as said, with dogs that change their interactions, whether it's like they become more sociable or whether they become less sociable. So for those that become less sociable or less tolerant, we need to make sure that they might need to be the house might need to be separated off, for example. If you've got a multi-dog household and the tolerance of the older dog to younger dogs is reduced, then we might need to keep them a bit more separate. Children need to be kept out of the way of an older dog that's either confused, blind, deaf, reduced tolerance for other reasons. If their play has changed, so for example, our little dog used to be obsessed with toy play. She used to love toys. You couldn't keep toys for her to publicly access because she would be that obsessed with them. She's now no longer interested in toys, and that might be because of her eyesight. It might be because she's just physically finds the thought of it a bit too intense. But she loves, and again, I wouldn't normally recommend this, particularly not in puppies, so any puppy owners watching this, she's 16 and a half, loves a little bit of hand play, gentle kind of hand play, and she's still very inhibited in that respect. So we just go with it. We have adapted our play to match what she is telling us she enjoys still. So I feel like I'm just rabbiting on. I have rabbited on, that's why. If anyone has got any questions at all before we finish up, feel free to pop them down. As I said, I will pop some of the resources, especially the quality of life questionnaires, and some books and some good online articles that I will happily pop down in the comments. For those who are watching who've got older dogs with maybe the physical changes that I've been talking about, the Canine Arthritis Management Facebook page and website is a hugely brilliant resource. Yeah, as I said, if you any recommendations for supplements to offer support, there are loads out there. I'm not going to recommend any specific brands, but as I said, your vet will probably stock some or be able to recommend some. But I will maybe in the comments just write a list of the kind of ingredients that you might want to be looking for in a supplement or a diet that's aimed at the older dog. But as I said, your vet will be the best person to speak to about specific brands of supplements and what they will stock as well, and the reason that they stock them. Sorry for not being able to be too specific. But yeah, I will write a list of some of the ingredients in the comments in case that's helpful. Yeah, any last minute questions, please shout away, and I hope that's been helpful. Just checking the notifications there. Okay, so as I said, if you've joined us late, then feel free to pop a comment or a question, and I will keep my eye on it over the next day or two and pop an answer in, or give you a resource if I can't answer it quickly. But thank you for those for joining live, and hopefully we'll have another live Ask the Expert with somebody else sometime soon. Have a good evening.